Hi, my name is Eric Juarez, and I've had melanoma since 2011 in November. Melanoma lymphoma. It started off on my arm. I had surgery and I had a junior mint-sized mole removed from my arm, and the melanoma turned into lymphoma. It went into my lymph nodes and spread throughout my body. I had tumors all over my lungs. I had 3 tumors in my head. And at the time, I started radiation on my head. That's called cyberknife, where it's directly put into the side of my head to remove the tumor. And so what I'm going to go over in this video is just where my intro of my journey of having melanoma lymphoma, and try to bring it up to date as quickly as I can. So this year, May 2nd of this year, I suffered a stroke from the melanoma. It had returned. I had a 6x7 tumor in my head, which I'll have a slide here in a moment to show you the CT scan. Here's the CT scan for my stroke on May 2nd. And that was those are the CT scan pictures that I had from my tumor in my head, which gave me a stroke, and that's one of the reasons my speech is a little bit impaired. And then my left arm is flaccid, it's not working, so I'm going through physical therapy right now. So starting back in 2011, when I found out that I had melanoma, I was with Scripps, and at the time I started interferon, and it's an immune therapy that they had given me that I was taking every day for a couple of weeks, which made me very sick. So if that is a drug that your oncologist was looking for, is the interferon, just let you know that you will get pretty sick, and it's you feel like all your muscles in your body don't feel right. You just feel like it's the most sick you've ever been in your life. So if that's the one way, but it does help. It does reduce the size of the tumor on my melanoma that I have. So if you have melanoma, you may have there's a couple of different melanomas that are there. There's like a BRAF, and then there's a couple of different other ones. What has to happen is your oncologist has to do a biopsy of the tumor that you have, send it off, and do the DNA testing on it to make sure that you get the proper drug for the tumors that you have, for the cancer that you have. And if it gets into your lymph nodes, then you may have to have some of your lymph nodes removed. I had 11 lymph nodes removed under my arm, because that's where the cancer had started, was on my arm, and it had spread through my lymph nodes. And so they had to do they had to remove 11 of them under my arm. So, and then they will let you know what the side effects are if they remove too many. Typically, if they remove too many, you will have swelling of the arm. Your lymph nodes are part of your circulatory system. So with having 11 removed, I didn't have any issues. I had no swelling. I had no pain. I didn't have any side effects that I could feel. And so, along with having the stroke, I also I had a seizure. So I'm on Keppra, so it kind of makes me a little bit tired. So sometimes I kind of will stumble on my words. I apologize. So going back to the tumor under my arm, they removed the tumor that was there. It was a ping pong sized tumor that was under there. So first I had the one that was in my arm, and then I had one that was growing under my arm, and then I had one on my clavicle, which was kind of hooked around the clavicle. They had to remove that one too, so that was an additional surgery, which was a few months later. And additional to the interferon, after the interferon had ran out, the oncologist at the time said that there wasn't anything else that he could do for me, so suggested me to go to another facility, Angeles Clinic for Cancer. And then my brother had also recommended that I looked at somewhere down here, UCSD, which I did. and I got with Dr. Gregory Daniels. And one of the oncologists that was there up in Long Beach at the Angeles Cancer Clinic had recommended that I stayed with Dr. Daniels because he was very knowledgeable, and I agree with that. He put me on a study that was with the Optivo that you've seen on TV. It's an immune therapy, which I had done a lot of research on, and there was an 86% reaction, a positive reaction to patients that were on it. So I agreed with that, and it was a triple blind process where I didn't know, they didn't tell me anything, they didn't tell my doctor anything. They also didn't tell the hospital any progress or what drug I was on. I ended up finding out that I was on Optivo and a placebo. So we were hoping it was Yervoy, which Yervoy is another immune therapy that came out in 2006. It's more for your brain. It works better for that. And then the Optivo was more for the rest of the body, which I reacted quickly to. Within probably 30 days, maybe 60 days, I had another MRI and a CT scan, and it showed that there was a significant reduction in the tumors that I had, especially in the lungs, because I had hundreds of tumors in my lungs. It looked like stars when we went over the CT scan. So there was a significant reduction. So I was on that study for a few months, and then I had come off the study, and we just started doing the Optivo. And that study was back in 2013, and then I started Optivo in 2014 or 2015, I can't remember. So I started it then under my insurance, and so after a few months of that, it was working very well. But just to let you know, prior, when I was on the study, I was still working. I worked at a dealership here in Escondido, so I was still working even when I was under the Optivo. So the side effects were very minimal. It did make me a little bit sleepy, and that's about it, and a little bit forgetful. So the side effects of Optivo and Yervoy at the same time was very minimal. So it kind of gives you an idea. If I was still working, it wasn't too bad. So I just kept doing the Optivo for another almost year, and at the end of 2015, it was nearly gone. Everything was nearly gone out of my body, all the tumors and all the cancer. So when we did a CT scan, I was almost clear. So going into 2016, we had kept going until about June, and in June we decided to not do it anymore because I was clear of any tumors in my body. So we stopped at that time, and we had done another CT scan every 6 months. Having this disease, you have to have a CT scan or MRI every 6 months, depending on where the tumors are. My tumors were in my body and they were in my head. So I was having MRIs with and without contrast in my brain and throughout my body. So contrast is very important. What that does, it lights up the tumors because the tumors are full of sugar. And so the contrast lights that up so the doctor can see where it's at. And typically the doctor he'll sit next to you and let you look at the CT scan and go over that. That's what Gregory Daniels did. He was very informative, and bedside manners were the very best. He let me know what was going on every step of the way, what he wanted to do, what his colleagues wanted to do, because it wasn't just him, it was other colleagues that were following me as a patient, as a study. So I appreciated him letting me know that this was all going on. And he also wrote a paper on me, and Brian, his PA, was there too. And Brian is fantastic. Always got back to me with any questions I've had. If I had to leave a message, they would get back to me. And many times Dr. Daniels would talk to me personally over the phone, which I appreciated because I live almost 45 minutes away from the facility that he's at. So getting a phone call from him was important. And up to now, I had to drop that insurance. I'm on a different insurance, and that's some of the things I'm going to be going over these videos. So I hope you follow me. I hope you subscribe, and I will let you know everything that I've gone through not only the medication and the side effects that I've been dealing with melanoma, but the billing, because the billing is just as important as understanding this disease and the medication that you're going through and the side effects. So I have learned a lot on many different facets of having melanoma, not just the disease, but how the billing works, and make sure that I plan for all the bills that are coming in. I mean, because I'm not rich, and so I have to pay these deductibles. So it's a lot out of savings and understanding how to deal with Medicare and Medi-Cal, and how to get the most you can out of these two resources. The state does have a lot of resources for you to help. One of the programs I'm on is called SCAN, C-A-N, SCAN with Medicare. They're a provider that helps monitor the Medicare billing, which is monumental. It helps me and it helps my family not have to deal with all the bills. And they also give me a ride where I need to go. So that's important. That's why I'll be going over all these videos. So I hope that you check my videos out in the future and subscribe. And also I'll have a link below for my email. So if you have any questions about melanoma or you have any comments, I would appreciate just commenting below. Also, I have a GoFundMe, and that's just to support myself, because at this time I don't work. And it's stressful on my wife, hard enough for her to deal with this, and my family. My parents do come over. Luckily, they're retired, and they watch me once in a while, because with the stroke, it's difficult to get around. As a lot of you probably know, if you have friends that have strokes, I can't drive, so they get me around. I'm lucky to have some friends that are able to help me out. And then I'll be going over some of the, it's like the CyberKnife, what they have done to me, how a lot of the appointments help work out. And also I'll be giving you some insight to the doctors that I work with and following me on my journey through my chemo and my immune therapy and everything that I'm doing. Again, my name is Eric Warriors, and I'm a cancer survivor of melanoma lymphoma. Thank you.